infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Now, federal and state health officials have been investigating a multi-state outbreak of the parasitic infection Cyclospora. It's been linked to salad mixes distributed to McDonald's by a company called Fresh Express. This outbreak was declared back in mid-July. The latest numbers from the CDC put the parasitic outbreak to over 500 cases from 16 states. Now, Fresh Express pulled the salad mix during the last week of July from McDonald's. Last month, the president of Fresh Express, John Olivo, announced the formation of a Fresh Express Blue-Ribbon Panel to study the Cyclospora parasite. The appointed chair of this panel is University of Minnesota Regents professor, McKnight Presidential Endowed Chair in Public Health, and director of the Center for Infectious Disease Research and Policy, better known as CIDRAP, Michael Osterholm, Ph.D. And he's my guest today. Dr. Osterholm, welcome back to the show, sir.
Thank you. Great to be back with you.
Okay, well, let's go ahead and start with the Cyclospora outbreak. And I remember back in the reasonably large 2013 outbreak that affected the Midwest mostly, experts then were telling me how difficult these investigations are. Dr. Osterholm, what makes these types of investigations so perplexing?
Well, first of all, we have to take a step back and just focus on what do we know and not know about cyclosporiasis and the disease caused by Cyclospora cayetensis. What's really, first of all, most telling is that the first outbreaks that we recognized in the United States were actually associated with consumption of Guatemalan raspberries back in 1996. And I was actually asked to write the first editorial to go with that in the New England Journal of Medicine back in 1997 when that outbreak was published. And I laid out a series of questions that said, until we answer these, we're not really going to know necessarily how to control cyclosporiasis when it comes in, particularly an imported product. Well, you could probably take that editorial today and just change the dates around from 1997 to 2018, and many of the same questions still hold. It's a disease that, as a parasite, we believe humans are the primary reservoir. Could be animals of some degree, we don't know. Second of all is it's unusual from a fecal-oral transmitted agent standpoint in that you have to actually go through a maturation of the parasite outside of the host, for which we believe it's about 10 to 14 days before the parasite is actually infectious to another human. That is in part what we think is the case in terms of number of days, but we don't really know. That obviously has impact on food, so this is not a typical food handler type situation, even though humans may play a huge role. The third thing is that we have had literally outbreaks virtually every year since 1996 involving one or more different kinds of produce products, berries. Cilantro has been frequently involved, carrots, and now more recently potentially romaine lettuce. And the outbreaks almost always cluster between mid-May and late July. Why that happens, we don't know. We raised the questions with Guatemalan raspberries when back in the 90s, when they were allowed to be imported in the United States, we had spring outbreaks. Literally, Canada in particular, which continued to import them, had them for 4 consecutive years, all in those same dates. And yet there was a fall harvest that never resulted in outbreaks. So we really don't understand why this seasonality occurs, why the different products. Now, what made this year very different was this is the first outbreaks we've seen in the United States that are actually related to product produced wholly in the United States, meaning the good agricultural practices and how the various leafy greens and so forth were produced have in the past appeared to prevent that kind of a situation from occurring. So one of the questions is, what made it different this year? Is it workers? Is it migratory birds? Whatever. And we don't really have the answer to that yet, and that's why we're trying to do the work we are to really better understand the state of the art so we don't have to keep referring back to that 1997 editorial saying, what do we need to learn?
Gotcha. So that's essentially the purpose of the panel that you'll be heading.
Yes, well, Fresh Express has had a long history of very progressive food safety work. Back in the early 2004-5 time period when the whole spinach situation with E. coli occurred, Fresh Express had no involvement with any of those, yet they put together a Blue-Ribbon Panel on an industry basis to try to understand what can we do to prevent E. coli contamination of leafy greens, and actually ended up awarding several $1 million worth of research money to both the public and the private sectors to better understand that. And with that came a number of changes in good agricultural practices that has greatly reduced the likelihood of that from happening. Here, the same thing is true. The entire industry is really asking questions: what can we do or should we do to make sure that we don't have this happen again? And without knowing what did happen, how did it become contaminated, what is the reservoir, what was the mechanism to transmission, what time period is necessary for a product to actually be held before the oocyst or the parasite basically becomes mature enough to actually cause human infection. Just a lot of questions remain. And so this panel will be working closely with the regulatory agencies, with public health agencies like CDC, and with public and private sectors, academia, to say what is it that we need to do here so that we don't have these happen anymore.
Right. It sounds like you're going to have your hands full. Those are a lot of tough questions.
They are, and I don't want to suggest we're going to have all the answers, but I think, trying to provide a systematic means of highlighting and prioritizing what are the questions that remain. What do we know? Why is the springtime peak occur year after year? What is it that before had the outbreaks associated with product from Central America or Mexico? Why change? What's the change this year that occurred? And so there's lots of questions that we can start to work on. And in the end, I think that by improving the produce world safety relative to cyclosporiasis, we're going to just continue to improve it for all pathogens. Right.
Some great work in public health there. Dr. Osterholm, let me go ahead and switch gears to another topic that I found pretty interesting. I saw it in a report in the New York Times last week, and it was about China not sharing H7N9 avian flu samples as per international agreements. Let's start. What is this international agreement?
Well, first of all, it's basically affectionately known as the PIP agreement, which is really about pandemic influenza preparedness agreement to share isolates, and this was put together right after the 2005 H7N9 situation first arose, and there were questions by countries like Indonesia about sharing specimens, and would that mean if vaccines were made from those specimens, would they themselves have access to those vaccines and so forth. And I think the story in the New York Times surely highlights a concern, but I think that it overstated the real challenges or the problems and what the solutions are that have happened. The Chinese actually, while not sending isolates out around the world as such, they have provided a fair amount of information through WHO and through a system that we have today for publishing sequences and so forth. And clearly we need more information, but there's some legitimate issues that have been raised about sharing such information. What does that mean if vaccines are needed and so forth, and you use these isolates for vaccines? I would be a little bit cautious because there was this kind of what I would call almost picture painted that suggested that but for if we didn't get these isolates, we wouldn't have vaccines if an outbreak emerged. And that's just simply not the case. When an outbreak, i.e. a pandemic, begins to happen on a global basis, we're going to want immediately that isolate which is causing the pandemic. So we want timely sharing at that point. But, having not shared isolates to date in of themselves have not made for, we don't have vaccine now. Because, in fact, we will use, obviously, any stockpile vaccine that we have for example, like an H7N9. But in the end, the real punch is going to be in actually having the actual isolate for a strain. So we need to continue to work on that. But I think that the story wasn't nearly as grim as that article painted.
Oh, okay. Well, that's good to know. And if this is a political move by China, which, of course, I have no idea, but in the name of global public health, what can be done to get that reversed?
Well, the WHO is actually actively working with China on these issues and making sure that we have as much transparency as possible. and trying to understand that, none of us own or possess the crystal ball that says, okay, this is going to be the next pandemic strain. This is what we need to be looking at. Just like H7N9 emerged in 2009 in Mexico, I think we're going to find ourselves one day up to our knees in the quickly growing pandemic influenza problem at the same time as we now say, okay, this is the isolate we have to use for a vaccine. That always puts us behind the eight ball because, as we know, like trying to grow corn in the upper Midwest in the summertime, if you plant twice as many acres doesn't mean you can harvest it in half the time. And so we're still going to have a challenge with producing these vaccines and the amount and how well they work. But in of itself, I don't think that we're at a point right now where we're being hindered in not having a vaccine that is going to make all the difference with an emerging pandemic. I think we learned back in the 2005-07 time period when people thought, all we need is a stockpile a lot of Tamiflu and we'll stop a pandemic. Once it starts to emerge, we'll just basically smother that geographic area with Tamiflu. And, of course, statistical models all said, that'd be great. But in the end, the reality is that by the time we recognize an influenza pandemic emerging, it may be in 40 countries. That's how fast it spreads. So I think here we need to have we need new vaccines, frankly, that are cross-protective against a number of strains. We don't have to wait for the pandemic strain to emerge before we have the ability to protect people. We need to be able to provide that vaccine on an international level, meaning that just not the developed world countries have access to it, which is pretty much the case in most instances with the pandemic. And we have to make sure that it's affordable so that these vaccines will be used. And if we had that, we could really put a major punch into the pandemic impact and knock it down. So this is the key issue is to keep working on these universal or game-changing flu vaccines and not have to wait until the pandemic emerges before we actually try to respond.
Well, very good. I want to thank you, Dr. Mike Osterholm, for your time and your expertise, your thoughts, and congratulations on your appointment as a U.S. Science Envoy.
Well, thank you, Robert, and thanks again for having me. You do a great public service with this activity. We all listen to it and really appreciate it.
Well, thank you. Have a nice day, sir.